8 facts to know about TNBC when you learn about it and you want to explain it to others. Here are the 8 things that are helpful. Again, breast cancer is defined by 3 markers: the estrogen receptor, called ER, progesterone receptor, PR, and the human epidermal growth factor receptor, called HER2. And when these receptors are present, they're called positive. And when they're not present, they're called negative. So if you've got triple negative breast cancer, it means you don't have any of those 3 receptors. Although we found out today that there's more to dig in terms of the HER2 status, and maybe it's low, HER2 ultra low, whatever, where there may be more treatments against HER2 for those people. And about 10 to 15% of people with breast cancer have triple negative breast cancer. It can be harder to treat and it can be more likely to come back. But we have new treatments today that are making that less of an issue. TNBC tends to grow faster, and it can act more aggressive compared to breast cancers that have receptors for estrogen, progesterone, and HER2. The symptoms for triple negative breast cancer are kind of the same as with other types of invasive breast cancer. That's invasive when it starts in the milk pipe or the lobule in which it starts and it breaks through that area. Testing is required to diagnose TNBC, and your pathology report will include that as a part of the diagnosis. If you don't have very much in that pathology report, push the doctor and say, can we find out more about what they saw? Because we know there's subtypes out there, right? And as we've talked, because TNBC doesn't have receptors for estrogen and progesterone, it's not a kind of cancer that responds well to hormonal therapies that do their work in those receptors. And as a reminder, TNBC isn't one disease, but as we've talked about, it's a group of breast cancers with distinct characteristics or personality features. TNBC research is looking at better understanding what TNBC is, what turns it on, what turns it off, what are the best new treatments, and how to give treatments that work really well with fewer side effects. We need more research. So ask your doctor if there is a research study available to you. TNBC treatments can include, when you're discussing your treatment plans with your doctor, talk about the possibility of like the lineup of treatments, if it's chemo, surgery, radiation, or various orders depending on your unique situation. Your doctor may also recommend immunotherapy, and if the cancer is HER2 low or HER2 ultra low, instead of assuming it's HER2 negative, you may also be a candidate for a targeted treatment called an antibody drug conjugate, which we told you is sort of like, hiring a spy with a backpack. You tell them where to go, where to drop the backpack of treatment, which delivers the chemo in a more targeted way to the cancer cells, and that involves less in the way of side effects. You also want to look into getting genetic testing. Beyond determining your risk of getting breast cancer, genetic testing helps us pick the best treatments for you and helps us figure out how best to follow you over time, especially if you have like a BRCA, BRCA1, 2, or PALB2 mutation.